just begin with the fascia. So according to the Shevkunin scope classification, there are 5 distinct layers to the neck fascia. First of all is the superficial cervical fascia. So it is the externalmost fascia and it envelopes the platysma and the external jugular vein and cutaneous nerves and lymphatic
Everyone, respected teachers and my dear friends, we are here to present a PPT on topic anatomy and the amputations of upper limb. Let's start.
So in this presentation, we'll discuss about the key points majorly on about the functional anatomy, little bit of anatomy.
My topic is trepanation. So today we will talk about the trepanation and what is trepanation, its types, how we will do operation both the types, and how we will its indications and contraindications.
This is Toshifa, and today we are going to discuss about surgery of a shoulder joint.
Let's start with anatomy. In shoulder joint, there are going to be two joints, acromioclavicular and glenohumerus, which is formed mainly by clavicle, scapula and humerus.
Which method you can use to understand about condition of coronary arteries, except this method? Which else we can use?
Sir, we can use computer tomography also. After giving that, we can look the procedure from X-ray also. Normal X-ray also can be also the procedure. MRI. You can use MRI for the knowing of
Students, so today we are presenting you organ transplant under the guidance of our beloved team, Marina Rustanova, and our teacher, Alana Maratovna. So I am Vedvati Shanoy from 3rd year 222B, and this is
match that a skin by making it perforation or incision in the
as well as we can see thoracoacromial ligament, and we can see another deltoid muscle. And inferiorly we can see there are like round head of triceps, as well as we can see axillary nerve, as well as we can see a posterior circumflex arteries, and we can see anteriorly like this is the anterior portion. So here we
congenital hypertrophy, pyloric stenosis, and peptic ulcers, and there's complication and surgical management. First, we will talk about basic anatomy of stomach. It is divided into 5 parts. First, we can see fundus over there. Then we can see cardia, body, antrum, and pylorus. We will talk about the blood supply. There are 4 major blood supplies: left and right gastric artery, left and right gastroepiploic artery, and veins are of the same name. We will further proceed. We can see here is the pylorus. In this disease, the pylorus is thickened. Because of this, the gastric outlet obstruction will happen. Tenderness, rigidity, guarding, and X-ray. We can see gas under diaphragm, but it doesn't signify that he has perforation where. The patient can have perforation anywhere. Or sometimes, if it is retroperitoneal, then he will show renal vein site. That means there will be gas around the kidney, or maybe sometimes it can mimic acute appendicitis. So first we'll manage peritonitis. How will we manage it? We'll keep the patient under nilper oral. We'll give him IV fluids. We'll give him antibiotics covering both anaerobic and aerobic. Then we'll give him analgesics for pain management. After doing all this, we are preparing him for emergency laparotomy. If we have a clinical case, we can think of a patient who went through surgery. Maybe after 2 to 3 weeks, he had gone to a party and he ate 1 cake and 1 cola. So it is a very high sugar drink. Because of its high sugar content, we know it is hyperosmolar. It will attract water into it. And when we know there is a lot of water, it will suddenly flush out. So it is known as early dumping. But in that much time, the body sends signals to pancreas. Pancreas releases insulin. So there is less food available over there, more insulin. So the person will go into hypoglycemic state. Vagotomy right now we are not using because of protein pump inhibitors. Eradication. So eradication therapy, first the patient will come. There are 2 types of diagnostic method: non-invasive, invasive. Non-invasive will start. In that we'll see urea breath test, urea breath test. After that we can do stool test to see antigen, or we can do serology test to see IgM. for antibodies against H. pylori. After if we suspect there is H. pylori, we have to do first line treatment. In that we'll give triple therapy or quadruple therapy. Triple therapy is
H. pylori is quite high. Depends on the country and the geography and other stuff. But not all of people who carry H. pylori give them some problems like.
First of all, mostly Japan people are more susceptible to this disease, and it lives in this stomach environment because of enzyme urease. Urease makes a thin layer around it, so it will not die in that acidic environment.
Yeah, I understand.
Ну, они все большие молодцы.